If you've been stretching your piriformis muscle because you either have sciatica, piriformis syndrome, or just a lot of compression here and you're not getting the results, that's likely because stretching just isn't addressing the root cause and it's not going to make a meaningful change. We need to essentially teach the pelvis how to open up. The piriformis attaches from these 2 points here, and when our pelvis is too far forwards in space, this creates external rotation of the hip and of the pelvis, closing off these 2 points like this. So really what we need to do is teach the pelvis how to open back up. There's 2 ways that we're going to address this. Step 1, grab a block from block therapy or a tightly rolled up towel, and we're going to position this on one glute at a time, approximately in the middle of the glute. You're going to be bending the opposite leg to its side for stability. Now you're going to very slowly just relax into this position and following your breath, exhaling 6 counts, inhaling of 4 counts. We want to spend a minimum of 3 minutes in this position to allow the fascia to rehydrate and release these adhesions. You can very slowly bend that leg that you're working, which is going to create more hip flexion and hip internal rotation to open up more of the backside of the pelvis. Once again, you've found areas of compression, maybe even some pain or discomfort. You want to spend time there to actually create that pressure to allow it to release and rehydrate. Once you spend the 3 minutes, nice and slow, exhale up and off. If need be, you can perform this on the other side. Step 2, grab that rolled up towel and position it between your thighs. Now you're going to be either leaning up against a wall or you can use a chair in front of you. As we're gently squeezing the block, we're going to be maintaining the stack with our diaphragm and our pelvis, and we're slowly going to hinge at the hips. The biggest thing is feeling the hips actually moving backwards, which is opening up the back part of the pelvis, which is what we need. Maintain a slight bend in your knees the entire time, and then as you are ready to come up, once you spent a little bit of time isometrically here, you're going to be pushing through the floor, maintaining the slight bend in your knees the entire time to bring the pelvis back to neutral. Perform about 5 to 8 repetitions doing this. Do 2 to 3 sets, and if you can perform these 2 things daily, you're going to notice a massive change in this area.